I am Lucy and I have a condition called Ehlers-Danlos syndrome, which is a genetic connective tissue disorder. This causes me widespread chronic pain and affects a whole wide range of systems in my body. So I get chronic pain from my joints, from muscle spasms, from my nerves, from my skin, from my gastrointestinal system. So it causes me a whole wide range of symptoms that really have quite a significant impact on my quality of life and have done since a young age. Before I was prescribed medical cannabis, I was prescribed a whole wide range of different medications to try and manage the different symptoms and then the side effects that I had. The medication that really caused the biggest impact on my life was the opioids, because I just needed these increasing doses of opioids, and they did very little to actually manage my symptoms, and I really kind of lost my ability to focus on the world around me and to engage in the things I wanted to do. I was just totally exhausted all the time, so I couldn't do things like physiotherapy that would make me stronger and make me better. So over time, I really went through a bit of a downward spiral where I was just taking more and more medications, and I couldn't focus and I couldn't attend school. I was mobilizing using a wheelchair, and the effect on my gastrointestinal system, I had to use a feeding tube. Really, things were really quite dire, and medical cannabis was really a last resort to try and improve things. I heard about Project 2021 through patient advocacy groups. Working with my doctor to find the right dose and cannabis-based medicines for me, and being able to access it at a cost that I could afford through Project 2021, and so having that really consistent supply of medication. Honestly, the effect on my life has been just transformative. I am now able to engage in the world around me. I sleep well, I eat well, really just very basic things that I think people probably take for granted, but when you're in debilitating chronic pain, you just can't function how you'd want to. And yet now my body almost feels like it's regulated, so I can get up in the morning, I can work, I can study. So now I'm doing a university degree, I'm living independently, I go for my daily walks and I do my exercise, just, things that honestly I always would have dreamed of doing, but were just not achievable based when I was on alternative medications. And now I'm in this space where I can do exercise and become stronger and just engage in the world around me and live my life like I should be in my 20s and have a social life, and just it's really is transformative. And I think the really remarkable thing for me is the fact that, my condition, I still have it. I will always have an underlying genetic condition. It's not going to change how my genes work, but it really impacts my symptoms, and it means that I'm in control of my symptoms, and I have a medication that just puts my symptoms down to baseline, and so I can focus on what I want to do and achieve what I want to achieve and live my life how I want to live it. For a very long time, medical cannabis has been stigmatized by both patients and clinicians and society in general. So I think a lot of people don't take it as a serious option, or that it might actually improve people's quality of lives, which is a real shame. And so I really hope that through developing evidence bases and having more people being prescribed these medications, people will start to understand that these are just medications that can improve quality of life just like anything else, but for some people with complex conditions, they're actually much more effective, and they allow them to live the life that they want to lead.